When I realized I was trans and I realized I needed chest surgery to survive, after the surgery, you know, I looked in the mirror and saw my chest for the first time, and I shifted immediately. It wasn't something that happened over like a period of time. I stood up taller, and I remember saying, wow, you shouldn't have to have the money to be able to feel this wholeness. I mean, you know, prior to the surgery, I was sitting there wondering if I wanted to live the next day. That was my question to myself every day. And now I can't wait for tomorrow. So, you know, that's what these surgeries do when you need them.
The American Medical Association and all of the medical associations have come forward and said this kind of healthcare is not cosmetic. It can be medically necessary on an individualized basis. Most trans people are living in poverty. So I think we both had this passion and this desire to give back to the community. I think we both knew that we couldn't do it alone.
So what Jim Collins Foundation does is connect with surgeons who are willing to provide services for a lower rate for a certain number of surgeries, and then offer scholarships, if you will, to the applicants. And the applicants have to tell write an essay and tell what their need is.
In some cases, they're people who'd been living on the streets, or they've been kicked out of their homes. I mean, the stories are absolutely heart-wrenching. It's devastating to see the kinds of situations that people are in, whether it's hormones or surgery or simply being in a space where people are affirming your gender, that people have a much better quality of life. They're less likely to be depressed. They're less likely to have issues with anxiety. They have better quality of relationships. They feel safer in the workplace. All of that gets better.
To watch these people soar where they were tentative, now they're certain. What could be more affirming of just how correct this is than these profound changes in the qualities of their lives?
I've been very fortunate over the past 10 years of doing this work to be connected with trans people from around the world. I see that too in being part of Jim Collins. For instance, when we called the grantees to let them know that they were selected for this cycle, the emotions that they express and the energy we had on the phone and their voices, it just made me cry, right? And you have goosebumps, and it reminds you again of the power of having help and finally being able to access something that you thought in the past would never be possible.
Our goal one day is to not exist. We don't want to exist. We want healthcare insurance places to cover this and that we can go away. But right now we're giving a piece of hope to the community that didn't exist before. We don't have paid staff, everybody's a volunteer. But I think the number one thing is know that every dollar counts in Jim Collins Foundation. So even if you give us $1 or $5, that's literally going to fund a surgery.
The reason we started this foundation was to create something that can have a direct link to help people right here and now. We literally know from people that we have helped save lives.
Yes.
And we have tattoos of Jim.
And we have tattoos.